And we're delighted now to be joined over the telephone by our guest for the afternoon, Dr. Nadia Zakhary, the former Minister of Scientific Research. Dr. Nadia, good afternoon to you, ma'am.
Good afternoon, dear.
Thank you so much, Doctor, for your time. And let me start by asking you, how do you see the achievements of the 100 Days of Health initiative or campaign that has been launched by the Egyptian state?
It's a very important initiative because, you know, we are now 105 million, so we need another initiative which has been launched since about 1 month ago,
Right.
and it has been promoted to other things other than the breast cancer. It started with the breast cancer, hypertension and diabetes, dwarfism, and now it has been promoted to other diseases like other types of cancer, and the waiting list has been diminished a lot.
Yes.
You know, it's not only for those who cannot pay for their checkup. Even those who can pay for the checkup have benefited from this initiative because we all work and forget ourselves and forget to make a checkup. But this initiative made us all make the checkup.
Absolutely, Dr. Nadia. And also another important part of this initiative was the checkups that were being held for children as well.
Exactly.
As we've seen convoys going to schools, looking for issues like child diabetes, obesity, etc. How important do you see the initiative targeting such a young age in order to, you know, weed out any health problems at an early age?
Sure, it's very important as well because, you know, the obesity is the cause of many diseases. It's not only for the shape of the body, but it is the cause of other diseases. Even cancer is related to obesity. So it's very good to know that we have to take care of ourselves by sports, by making a regime for the food and so on. Also the dwarfism was studied because it's a big problem for the children, that they are not playing sports and they are not living in a good, healthy manner. Even those who have a lot of money, they are not eating the good food that they have to eat. So this causes many diseases for them.
Indeed. Dr. Nadia, let me ask you, in addition to maintaining, of course, the health of the Egyptian citizens, what are some of the benefits, you know, that come to the state from such campaigns? For example, prevention being better than cure of diseases. Yes,
of course, prevention is better than cure, and even in early detection of cancer, if you detect the cancer early, this will cause about 90% cure for the patients. But if it is detected late, maybe the chance for cure is very limited. Other diseases, you can protect yourself from it, and it cannot come to you as totally, not only early stages and so on. Maybe in cancer only we cannot say that prevention will lead to diminished or to that the person would not have cancer. No, he will have the cancer, but at the early stages his cure is much more than having diagnosed at a late stage.
And let me ask you, Doctor, how do you see the importance of follow-up on some of the cases that were detected in the first phase? They're being contacted, followed up with, you know, given treatment plans that are being followed upon. How important is follow-up with regards to achieving the aims of such a campaign?
Sorry, I didn't get the question because the sound had
Sorry, yes, Doctor. I was asking you about the importance of the following up. Lots of patients that have been diagnosed have been followed up with regards to their treatment plan, medication. How important is following up as part of, you know, the success of this campaign?
The following up is very important for some diseases. For example, if somebody has cancer, he has to follow up for 5 years. So not only making him a surgery and he's cured, or taking chemo and radiotherapy is cured, he must follow up for 5 years at least. Also, I want to tell you something now. The initiative has been promoted to liver cancer, and as I think it will be, the liver cancer incidence will be less than before because of the campaign of the hepatitis C virus that had been done a few years ago, because
Yes.
the hepatitis virus is a cause of liver cancer.
Mm-hmm.
So now a campaign has been done for the liver cancer. You know, after hepatitis C infection, it takes about from 15 to 20 years for a patient to develop liver cancer. So this campaign is very important now, and the study of the genome of this disease is on its way now.
Absolutely, very important indeed. On that note, I'd like to thank you very, very much. Dr. Nadia Zakhary, the former Minister of Scientific Research. It's been an absolute pleasure. Thank you so much, ma'am, for your time and your insight and for joining us on today's edition of Cairo Local.